This is the math that nobody in Washington wants you to understand. Social Security just announced a 2.8% cost of living adjustment for 2026. The average retiree will see about $56 more per month. Sounds like good news. Finally, some relief for seniors struggling with inflation, except Medicare just announced their numbers too. The Part B premium is rising from $185 to $200.90 per month. That is an increase of $17.90, almost 10%. Your government gave you $56. Then they took back 18 of it immediately. For many retirees, the rest disappears into higher costs for everything else. You thought your Social Security increase would help. You thought the system was designed to protect you. You were wrong. In this special report, we are going to break down the great senior robbery of 2026. We are going to show you how Medicare premium increases systematically devour cost of living adjustments. We are going to expose why this keeps happening year after year. And we are going to explain why the people who built this country are being quietly impoverished by the people who claim to represent them. Let us start with the basic numbers because they tell a story the government does not want told. The 2026 Social Security COLA is 2.8%. For the average retired worker receiving about $2,000 per month, that translates to approximately $56 in additional monthly income. The 2026 Medicare Part B premium is $202.90. Last year it was $185. The increase is $17.90 per month. Simple subtraction. 56 minus 18 equals 38. Before you buy a single grocery, pay a single utility bill, or fill a single prescription beyond what Part B covers, you have already lost nearly a third of your raise. But wait, there is more. The Part B annual deductible is also increasing, from $257 to $283. That is another $26 per year you have to pay before Medicare covers anything. Part A, which covers hospital stays, has a deductible too. It is rising from $1,676 to $1,136. $60 more if you need to be hospitalized. Daily coinsurance for extended hospital stays is going up, from $419 to $434 for days 61 through 90, from $838 to $868 for lifetime reserve days. Skilled nursing facility costs are increasing, from $290.50 to $217 per day for days 21 through 100. Every single number is moving in the wrong direction. Every single cost is rising faster than the raise meant to offset it. This is not an accident. This is how the system is designed. The formula that calculates Medicare premiums is based on projected healthcare costs. When healthcare costs rise, premiums rise. When drug companies charge more, you pay more. When hospitals bill more, you pay more. But the formula that calculates Social Security COLA is based on general inflation, not healthcare inflation. General inflation. Healthcare costs have been rising faster than general inflation for decades, which means every year Medicare takes a bigger bite out of Social Security. This is structural. It is baked into the math. And nobody in Washington is fixing it because fixing it would require confronting the healthcare industry that funds their campaigns. Let me show you what this looks like over time. In 2020, the standard Part B premium was $144.60. In 2021, it was $148.50. In 2022, it jumped to $170.10, the highest single-year increase in history at that point. In 2023, it dropped slightly to $164.90 due to a specific drug pricing issue. In 2024, it rose to $174.70. In 2025, it jumped to $185. In 2026, it hits $200.90. Over 6 years, the premium increased by 40%. Did Social Security benefits increase by 40%? They did not. The gap widens every year. Seniors fall further behind every year, and every year politicians announce the COLA like it is a gift rather than a mathematical illusion. There is a provision called hold harmless that is supposed to protect people. It prevents your Social Security check from actually decreasing due to Medicare premium increases. But here is how it works in practice. If your COLA is smaller than your premium increase, you do not pay the full premium increase. Instead, your entire COLA goes to Medicare, and your check stays the same. You are held harmless in the sense that you do not lose money compared to last year, but you gain nothing. Your raise, such as it was, evaporates entirely. For 2026, this affects people whose Social Security benefit is $639 or less per month. If you receive less than $639, your entire cost of living adjustment goes straight to Medicare. These are the poorest seniors, the ones who need help the most, the ones who worked their entire lives for a retirement that barely covers expenses. They get nothing. The wealthier you are, the worse it gets in a different way. Medicare has income-related monthly adjustment amounts. If your income exceeds certain thresholds, you pay more. For individuals earning over $109,000, the Part B premium is not $202.90. It starts at $284.10 and goes up from there. At the highest income levels, above $500,000, the monthly Part B premium is $689.90. Now, you might say wealthy seniors can afford it, and perhaps they can. But consider what this means for middle-class retirees who sold a home or cashed out a retirement account or received a one-time windfall. Your income spikes for 1 year. Medicare sees that spike on your tax return from 2 years ago. Your premium triples. You pay wealthy person rates on a middle-class fixed income. The system does not distinguish between permanently wealthy and temporarily elevated. It just sees a number and bills accordingly. There is an appeals process. You can request a new determination if your circumstances changed, but you have to know about it, navigate the bureaucracy, provide documentation, and wait for a decision while paying the higher premium. How many 75-year-olds have the energy and expertise to fight the federal government over billing? The administration claims it actually saved money this year. The CMS announcement included this remarkable statement. If the Trump administration had not taken action to address unprecedented spending on skin substitutes, the Part B premium increase would have been about $11 more per month. Skin substitutes, wound care products. Apparently, spending on these products was so out of control that addressing it saved $11 per month. This raises an obvious question. If one targeted intervention can save $11, why is the premium still rising by almost $18? What about all the other out-of-control costs that nobody addressed? The answer is that addressing costs means confronting providers and manufacturers. It means fighting lobbyists. It means risking campaign contributions. Skin substitutes were apparently an easy target. Everything else is protected. Drug prices remain largely uncontrolled despite the Inflation Reduction Act's limited provisions. Hospital consolidation continues to reduce competition and raise prices. Administrative costs consume approximately 15 to 30% of healthcare spending depending on how you measure it. These are the real drivers. These are the reasons premiums keep rising, and nobody is seriously addressing them because the money flows in the wrong direction. Consider what $17.90 per month means to a senior on a fixed income. Over a year, it is $214.80. That is groceries for a month. That is a utility bill. That is medication that Medicare does not fully cover. That is a tank of gas to visit grandchildren. Multiplied by the approximately 65 million Medicare beneficiaries. The premium increase alone transfers roughly $14 billion per year from seniors to the healthcare system. $14 billion. Extracted from the people who built this country, transferred to an industry that already consumes nearly 20% of GDP. And what do seniors get in return? Not better care. The United States ranks poorly among developed nations on health outcomes despite spending more than anyone. Not more access. Rural hospitals are closing. Primary care physicians are in shortage. Wait times are increasing, not peace of mind. Medical bills remain the leading cause of bankruptcy. Surprise billing, while theoretically addressed, still devastates families. Seniors pay more every year for a system that serves them worse every year. And the political class treats this as normal. There is a generational dimension here that deserves attention. The people paying these rising premiums worked their entire lives when the social contract was different. They were promised that if they paid into the system would take care of them. They paid. Medicare taxes came out of every paycheck for 40 or 50 years. Social Security taxes too. They funded the system for the generation before them, trusting that the generation after would fund them. Now they are told the system cannot afford them, that costs are too high, that they need to accept less. But where did the money go? Who benefited from their decades of contributions? The healthcare industry grew into a behemoth. Insurance executives earn tens of millions. Hospital CEOs earn millions. Pharmaceutical companies report record profits. Administrative staff multiply while frontline workers burn out. The money went somewhere. It went to people who lobbied for the rules that let them take more. It went to people who funded the politicians who wrote those rules. It did not go to the 78-year-old widow choosing between medication and food. It did not go to the 82-year-old veteran whose COLA disappeared into premium increases. It did not go to the people the system was supposedly designed to protect. We call this a healthcare system. It is actually a wealth transfer mechanism. It moves money from the vulnerable to the powerful, from the sick to the wealthy, from the old to the connected. And every year, the COLA announcement pretends to be good news while the premium announcement quietly takes it back. This year, seniors got an average of $56 more per month. They lost $17.90 immediately to Part B premiums. They will lose more to Part D increases if they have prescription coverage. They will lose more to Medigap premium increases if they have supplemental coverage. They will lose more to higher deductibles and copays when they actually use their insurance. By the time you add it all up, many seniors will be worse off in 2026 than they were in 2025, despite the COLA, despite the promises, despite everything they were told. This is the senior robbery of 2026. It is legal, it is structural, it is bipartisan, in the sense that neither party has fixed it, and it will happen again in 2027 and 2028, and every year until someone decides that the people who built America deserve better than a mathematical magic trick that takes with one hand what it gives with the other. The COLA was announced with fanfare. The premium increase was buried in a CMS fact sheet. One got headlines, one got fine print. That is how they want it. That is how they have always wanted it. Now you know the numbers. Now you understand the math. What you do with that knowledge is up to you. $56 in, $18 out, and rising. The system could be fixed. It is not complicated in theory. You could cap Medicare premium increases to match the COLA percentage. If Social Security goes up 2.8%, Medicare premiums cannot increase more than 2.8%. Simple, fair, protective. You could negotiate drug prices more aggressively. The Inflation Reduction Act made a start. A real effort would go further. Every dollar saved on pharmaceuticals is a dollar seniors do not pay in premiums. You could address administrative waste. The United States spends more on healthcare administration than most countries spend on healthcare total. Cutting administrative bloat cuts premiums. You could end hospital consolidation that reduces competition and raises prices. You could reform payment systems that incentivize expensive treatments over effective ones. You could actually prioritize the people the system supposedly serves. None of this is impossible. Other countries do it. They pay less and get more. Their seniors are not choosing between medication and food. But reform requires confronting powerful interests. Pharmaceutical companies, hospital systems, insurance giants, medical device manufacturers, the entire ecosystem that profits from the current dysfunction. Politicians take their money, regulators seek jobs in their industries, think tanks produce studies defending the status quo, media companies depend on their advertising. The seniors who pay the cost have no comparable lobby. They have votes, but voting is harder when you are on a fixed income, when you lack transportation, when your polling place moved, when you are just tired. So the robbery continues, year after year, COLA after COLA, premium increase after premium increase. Welcome to retirement in America.